Hello, my name is Helen Worthington Smith. I'm a Project Support Officer with the Hertfordshire and West Essex ICS Primary Care Training Hub. Today I'm talking with Heather Ann Stiles, who is a healthcare assistant at Grange Street Surgery. Heather is with me today to talk a little bit about the role of healthcare assistant and what it entails. Thank you so much for joining me, Heather.
Hiya, thank you.
To start off with, can you tell me why you chose to work as a healthcare assistant?
Yeah, sure. So I actually started working as a receptionist and administration here at Grange Street Surgery. And just for being around the healthcare assistants and the nurses in the practice and getting a real feel for sort of the medical world, decided that it'd be something that I'd actually really be interested in getting involved with. And from there on, that was really how it all started.
Lovely. And why did you choose to work in primary care specifically?
Well, I had thought about hospitals when I was applying for even the administrative roles, but I think primary care is definitely for me. I like having the continuity of seeing patients more than once and for feeling like you're part of the community team. So you do work alongside, your community district nurses and other service providers within your community. So it's nice to have that sense of everybody working together for the community of people that you live and see and work around every day, and you really get to build a rapport with people. So I really like that aspect of things.
Yeah, absolutely. And that sounds really lovely to have that involvement in a patient's journey.
Yeah.
And how did you get into the role? Did you have to complete any specific training?
Yeah, so I started with phlebotomy, blood taking. That was a day course, and then from that, you do your observations and competencies, so you get signed off to say you're good to go with it. And then once I'd done that for a little while, I did a healthcare assistant course through the Hertfordshire Training Hub. That was a really, really good course. It really gives you a good background on things that not just as a HCA, but what a nurse also does. So you kind of know what you can, definitively what you can and cannot do. So it was a really, really good course to go on. Yeah, and then from that you can build on from your HCA courses to do other skill sets. So yeah, that's the courses really that I've done.
And did you complete the care certificate as well?
Yeah. So I completed the care certificate.
Perfect. And can you tell me what you enjoy about your role of healthcare assistant?
Yeah, sure. So it's really diverse. No 2 days the same. And it's really fast paced. And I think that's an environment that I like to work in. So I think the diversity really is the best thing for me. And it's really enjoyable as well.
Oh, that's really good. And can you talk me through a typical day? How does a typical day look for you?
Yeah, sure. So I generally have clinics in the mornings. They can sometimes go as smoothly as water off a duck's back, and then other times it'll be really challenging, and you'll have challenging situations and conversations with people. But that's the fun of it, I guess. So we'll have clinics in the morning, and then once I've finished up there, I help the nurses do ordering, so stock ordering, and putting everything away and making sure everything's nice and tidy. Infection control is a biggie at the moment. So checking fridges, door handles, light switches, all the stuff. You'll have lots of books to put your initials against to check everything. Checking machines that we have at the surgery as well. So your defib, your oxygen, just making sure everything works, because sometimes your defib can be sat in the corner, it's not been touched. So we need to make sure that it's definitely up and running. And then we'll go on to some admin in the afternoon. So I might answer the phones a little bit sometimes still, and follow up from patients that you've seen earlier in the week. They might need follow up, so just calling to arrange that as well. So it is a lot across the day. It sounds like a lot, but they're all just sort of small little things, but they're all just as important as each other. So it really keeps your day going. And it means before you know it, you're done and you're going home because you've just not had time to think about anything else.
Sounds like a very varied day, like you do a lot of different things, and I guess no 2 days are exactly the same.
Never, no.
And what advice would you give to somebody wanting to become a healthcare assistant?
Yeah, so I think the advice that I would give is to not worry about being nervous if you are nervous to begin with, because once you do your training and speak to staff and have your competencies signed off, that will go away. And that nervous energy is a good energy because it means that you care enough about it to sort of feel that way. And to just, yeah, be open-minded about the whole process of your training and use the people around you to your advantage. Like, that's what your mentor is there for. They're there for you to ask the silly questions, so to speak, because if you're not from this setting and you're not from this background, you're not going to know. So ask as many questions as possible and use the people around you, and don't worry about being nervous.
Well, thank you so much, Heather. Thank you for joining me today and talking about your role as a healthcare assistant in primary care.
You're very welcome. Thanks for having me.